Diabetes. It's one of the leading causes of vision loss in the world. And it's estimated that over 1 billion people in the world, yes, 1 billion people in the world have diabetes in some shape or form. And it can cause vision loss. So what can you do about it? Well, yes, there are medications, but on the other side, there are nutritional strategies and lifestyle strategies that can be used to help manage diabetes and hopefully reduce one's dependence on medications. Learn about nutrition and lifestyle for diabetes in this week's episode of the IQ Podcast. Stay tuned. Welcome, 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 everyone. Welcome to another episode of the IQ Podcast, where you can gain insights into your vision health and brain health and raise your IQ. I'm your host, Dr. Rani Banik, and today we're going to be talking about a condition that can really cause a lot of various different vision problems. And this condition is diabetes. And we're going to be approaching diabetes from a nutritional aspect. And we're going to have a very special guest on today who's really an expert. She's a diabetes coach. Also, she's certified in lifestyle medicine. So I'm really, really excited to learn from her. So our guest for this week is Jacinda Shapiro. Jacinda Shapiro, RN, is a dedicated lifestyle coach specializing in empowering individuals to take control of their health through simple, sustainable lifestyle practices. With expertise in managing all forms of diabetes, Jacinda advocates for a plant-based approach, emphasizing the power of nutrition in reducing medication dependency and improving overall well-being. Jacinda works with a diverse range of clients, including those living with heart disease, cancer, and other chronic conditions. Her mission is to help people achieve better health outcomes by addressing the root causes of illness and embracing whole food, plant-based solutions. Thank you so much for joining us, Jacinda, and welcome to the IQ Podcast.
Oh, thank you. It's great to be here. I really appreciate, Dr. Banik, the invite. This is an honor.
Absolutely. So Jacinda and I recently met at a conference, the Plant-Based Healthcare Nutrition Conference, that takes place annually in California. And she was on a panel and she was talking about her approach. And, you know, some of the things you said really just blew me away. And I was like, wow, I never even thought about it from that perspective. So I decided I had to have you on the podcast as a guest to share your experiences. But before we get into that, I always ask my guests kind of how did they get interested in what they do? So I'm assuming you started off as a registered nurse. How did you become so interested in nutrition?
Well, the journey was actually a long journey. I've been a nurse for almost 30 years. I started out in oncology in Seattle. I used to work at Fred Hutch Cancer Research Center, and my late husband was an orthopedic surgeon. Our second child came into the world with health problems. Immediately, he developed issues growing. He was diagnosed with failure to thrive. And he developed asthma. It was uncontrollable. He would have asthmatic episodes as he slept at night. He was covered with eczema. And here we have two healthcare providers inside the household, and everything we did made him worse. Every time we took him to see another doctor, he got worse. So a friend of ours told us we should read the China study. And at this point, we were actually doing a ketogenic diet, and it was not helping. And I had high blood pressure, high cholesterol. I had been diagnosed with lupus in the early 90s. And so I didn't think changing my diet, though, would do anything for my health. The only thing I was concerned about was my son. So we read the China study, and as soon as we were done, my husband was an orthopedist, and he was furious. He had never learned any of this information in medical school. And we decided we were going to jump in with both feet. Overnight, we went from keto to all meat to all plants. And within 3 months, our son, his asthma stopped. He was on, I think at the time he was on 8 different medications. He had asthma episodes as he slept at night. So he used his rescue inhaler every day. The nebulizer was used so much we couldn't put it away. It just stayed out on the counter. In 3 months, his asthma stopped. And Dr. Will Bolsewicz actually talks about this. He talks about taking poop samples of babies by the time they're 4 months old, and you can identify which baby is going to develop asthma. For myself, I normalized my cholesterol. What I mean by normalized, I've never had a total cholesterol over 160, and I've never had an LDL above 60 after going plant-based. But my lupus titers normalized after 12 months. And this I thought was my genes. I mean, I was always taught it was genes. There was
Mm-hmm.
really not much I could do about it. But it really changed the life of my son. In his senior year of high school, he was the fastest kid on the cross country team. He is an active scuba diver. He's actually a dive master now. These are things that wouldn't have happened if we had not been plant-based. So we just ended up learning more and more, and everything that I do after my husband died in 2018, I realized there was nothing I could do for work that would harm someone or harm our planet. And I realized that I needed to dedicate my life around this. And one of the biggest drivers of disease in our world is diabetes. We have over 500 million people who are living with diabetes. It's estimated, I think, who estimates that by, I think, 2050, we're going to have like 1.3 trillion people living with diabetes. And in the US, we diagnose 1.3 million every year. And for the most part, those living with type 2 diabetes or prediabetes, this is a preventable condition.
Yeah, well, thank you for sharing your story. It really is such a miraculous, incredible journey that you and your family went through. And oftentimes, it's not necessarily our own reasons for why we choose a certain diet or make a lifestyle change. It's because of someone we love. Right? We see someone going through that, whether it be a child, a parent, a spouse, and we want to do better for them, and we, make some changes that ultimately affect everyone. So in a positive way. So this is really a testament to how life-changing these dietary changes can be for some people with chronic illness. Now, you mentioned diabetes. I know it's one of your true specialties when it comes to taking care of patients. There are various types of diabetes. Could you explain, what is exactly type 1 diabetes? What is type 2? And I know now that there's a newly kind of identified or categorized form of diabetes called LADA. I hope I'm pronouncing that correctly. But could you just explain the different types so we can talk about that a little bit?
Yeah, first, I want to make sure everyone understands there are a lot of people out there that claim to be diabetes coaches. I'm a diabetes educator. I'm a certified diabetes educator. And so with that, I bring to the table, I practice as a coach so I can reach more people because my approach to healthcare differs so much with the rest of the medical community. But yes, so we have, and I specialize with everyone. I do insulin pump starts. I actually specialize with those living with type 1, LADA, MODI. And then we have pre-diabetes and type 2 diabetes and gestational diabetes. So when it comes to type 1, this is an autoimmune condition where the body ends up attacking the beta cells inside the pancreas that produce insulin. This is a really important hormone that most people think of it as the enemy, but it is not. It is essential for life. We would die without insulin, and so would all of our animals as well. Um, Ironically, even though we relate it to possibly a virus, we are really not sure what exactly causes type 1 diabetes. But in the last 4 years, type 1 diabetes has doubled. LADA is a slower progressing form of type 1 diabetes. It typically happens after the age of 30, and the onset, it's just a little slower progressing until that person is no longer able to produce any more insulin as well. There is a form called MODI, which is, it's related to a specific gene. It is not an autoimmune form of diabetes. And then we have pre-diabetes, which impacts almost 40% of the adult population. I think this is really important that we don't miss this because it is often missed at doctor's appointments when we can actually take action and preserve beta cell function. Type 2 diabetes for most people is driven by lifestyle choices. And most of that is our diet and
Mm-hmm.
other practices, how we move and how we sleep at night, how we manage stress. But most of it's actually driven by what we eat. Insulin resistance is the root cause of type 2 diabetes. And insulin resistance is actually caused from excess dietary fat, even though most people think it's a problem with sugar.
Mm-hmm.
And all diabetic complications are caused whether you live with type 1 or you live with LADA or you live with MODY or you have gestational diabetes that happens in pregnancy or prediabetes or type 2 diabetes. All complications are rooted in insulin resistance.
Could I just backtrack a little bit? You mentioned LADA and MODY. What do those stand for those who are not familiar? What do those letters stand for?
So LADA is a latent autoimmune diabetes in adults. MODY is mature onset of diabetes in childhood, but that is not really true. I see lots of people who get diagnosed with MODY later in life as well. But
Mm-hmm.
that is specific to one gene, and it's an autosomal dominant trait, meaning it will only take one parent
Mm-hmm.
to develop the disease. And if you do have a parent that does have this gene, you have a 50% chance of also
Mm-hmm.
developing MODY yourself.
Yeah. In those patients with LADA, so are they not producing any insulin at all? Or are they producing some insulin? Is it worthwhile, if you suspect that you may have LADA, or if you're a provider and you're seeing a patient who you suspect may have it, is it worthwhile checking insulin levels in those patients, or is there a separate test that you would do?
Well, just like type 1 diabetes, often you still have some insulin being produced in the beginning stages. Type 1 can progress a little quicker. With
Mm-hmm.
LADA, sometimes we've had patients that have had LADA and have gone years before they actually need insulin when they've adopted a plant-based diet. Um,
Mm-hmm.
so some people can transition quickly within a couple of years and need insulin. So it is, I think, there are some changes going on with checking autoantibodies, C-peptide levels, and fasting insulin levels. I think
Mm-hmm.
it's important that most providers, including primary care and pediatricians, understand the importance of checking islet autoantibodies. Um, if someone is positive for two autoantibodies, they will develop type 1 diabetes. And so there's some new guidelines changing with checking autoantibodies, especially in children, to
Mm-hmm.
prevent diabetic ketoacidosis. In our regular patient population, it is important when we check an A1C that we check a fasting insulin level at the same time. And I do recommend if someone has a higher A1C, or higher fasting insulin levels, that we also check a C-peptide level as well to determine how much insulin the beta cells are producing. We can see changes with people living with type 2 diabetes. If you've had type 2 diabetes for a very long time, you can have very low C-peptide levels because at the time of diagnosis, 50% of the beta cells are dead. But you don't need a lot of beta cells to produce enough insulin. So if you can catch it early enough, also some
Mm-hmm.
medications, statins, Repatha, a lot of medications that people are taking for heart disease impair their blood sugars. And when it comes to the statins, someone who's been on them for a long period of time, we can see elevated blood sugars that even with a plant-based diet, their beta cells just don't seem to be producing enough insulin. But
Mm-hmm.
LADA just progresses slower. And in time, they will no longer produce insulin and they
Mm-hmm.
will take insulin just like someone living with type 1.
Mm-hmm. I wanted to share this patient I saw recently. So last fall, about a year ago, this young girl, she was 4 at the time. She had a viral infection, an upper respiratory infection, and she took antibiotics for it. And then she had a second infection, and then she developed various unusual symptoms, visual symptoms, but also systemic symptoms. She had polyuria, polydipsia. She was hungry all the time. And, she was a little bit overweight for her age when she first kind of came in. She also developed systemic autoimmune symptoms like a droopy eyelid and also double vision. So, what ended up happening, to make a very long story short, is that this young child was diagnosed with type 1 diabetes, so autoimmune, and also myasthenia gravis, autoimmune, at the same time. And, whether this was a viral infection that kind of triggered this, we don't know. But are there also potentially genetic risks for type 1 diabetes?
Well, it turns out that it's something like 80% of those who develop type 1 diabetes have no family history.
Mm-hmm.
Um, so evolution takes thousands of years. We have doubled type 1 diagnoses in the last 4 years.
Mm-hmm.
So even though genetics potentially could predispose us to type 1 diabetes, there's too much information about lifestyle,
Mm-hmm. Mm-hmm.
including for, children who develop type 1 diabetes. We have data. It's just not enough to be able to say that, yes, like dairy, but we have data that shows that, dairy consumption can trigger the response as well.
Mm-hmm.
So, for Modi, yes, it's that one is genetic.
Mm-hmm.
For type 1, for Lada, it involves over 50 genes, over
Mm-hmm.
50 genes, and we're identifying more and more as more research moves forward. But it's what triggers this response. So you had mentioned that she was on antibiotics as well. So
Mm-hmm.
Hippocrates, 2,500 years ago, said all disease begins in the gut.
Mm-hmm.
And it took us almost that long to prove him right. But when we take antibiotics, they're not selective. They're not going to go in there and just wipe
Mm-hmm.
out, healthy microbes are wiped out when we take antibiotics. And maybe this could be a precursor to her development of type 1 diabetes as well.
Yeah, I hadn't actually considered that aspect of it for diabetes. I know that there are certain antibiotics that are linked to myasthenia gravis, but that's really an interesting
Mhm.
thought. So I will look into some of the research on that. So shifting gears a little bit, but still talking about diabetes. We know that diabetes can cause many complications, especially when you have chronically elevated blood sugar, elevated hemoglobin A1C. What are some of the most common side effects of poorly controlled diabetes that you've seen in your practice?
Well, the the most important side effect to actually talk about with poorly controlled diabetes is heart disease. Heart disease is our number one killer. 2 out of every 3 people living with diabetes will die from heart disease. Most of it's heart failure. Um, then secondary is chronic kidney disease. Half of everyone diagnosed with kidney disease is due to diabetes. And the thing with kidney disease, it's a silent killer. Most people don't know they have it until they need dialysis. Um, then we have fatty liver disease. Fatty liver disease, the number one cause is non-alcoholic fatty liver disease, and that term has actually recently changed, but to MAFLD. But what's important about that is that this is a response to our lifestyle habits, to diet. Increase in dietary fat leads to complications with our liver. In fact, to be diagnosed with type 2 diabetes, you need to have fatty liver disease. The fat begins to deposit in the liver and then the muscle and then the beta cells before you can develop insulin resistance. I have patients who have lost vision. So the leading cause of blindness is diabetes, right up your
Yeah.
alley
And
here.
I'll share some numbers with you. So you were talking about how many people in the world have diabetes. It's estimated that at least 100 million people in the world have diabetic retinopathy. So not just actually mild disease, but disease that actually impacts vision. And that number is expected by the year 2050 to go up to over 160 million. And I think that's really an underestimate. I really do, because there are so many people in underserved areas of the world that are not getting diagnosed. They're not getting diagnosed for diabetes, but they're also not getting their eye exam. So I think that's a very conservative number. It's a major problem, and patients come in with blood sugars oftentimes very uncontrolled, hemoglobin A1Cs 8, 9, 12, 13. I've even seen 14, 15, and they have just horrible diabetic retinopathy. And the saddest thing is that all of this could be prevented.
Mhm. And if you
It could
catch
be
it early
prevented.
enough, so I worked with someone who had an A1C of 17 when I started working with him. He was already losing eyesight in his right eye, but he was young, early 30s. He gained his eyesight back. He was almost 500 pounds. Within 18 months, he dropped to 180. He had neuropathy. He had trouble walking, high blood pressure, high cholesterol, and he had vision loss in his right eye.
Mhm.
So if you can catch things early enough, but the key to all of this is prevention,
Mhm.
prevention and beginning with
Absolutely.
our children. The percentage of children between the ages of like 14 and 17, Dr. Kaushik Reddy, who is an interventional cardiologist out of the VA of Tampa, he actually has a TED Talk. If you Google carrot and stent, you can find him. He presented locally for me to speak to diabetes educators in my area. And he said the percentage of children who, through the American Heart Association, through their guidelines, not my guidelines of fiber and fruit and vegetable intake that I recommend people consume, but through their guidelines, the amount of children who have a healthy diet in that age group is 0. I think it's 0.001%.
Oh my
So
goodness.
children born from 2000 on are not expected to live a longer life than their parents. The average adult only consumes about 14 grams of fiber a day,
Mhm.
and children, it's less. And as we went at the last medical conference, I've always told my patients you need 50 grams of fiber a day. But our ancestors consumed over 100. And Dr.
Mhm.
Scott Stoll at our conference said, hey, we have more data coming out. It really needs to be like 60 grams of fiber or more.
Mhm. Mhm.
And this is what helps to
Wow.
diversify. And so, if we can get to our kids, you look at the school lunches. I took in a homeless kid a couple of years ago, and you look at the school lunches and what they're fed, and look at what we pack our kids. So
Mhm.
most parents put a seatbelt on their kid or put a helmet on their kid, but what they are most likely to die from is heart disease or cancer, and
Mhm.
and it is driven by our dietary choices that can begin in utero, and it begins when
Mhm.
children choices that they're
Yeah.
making now.
Absolutely. Well, that was so beautifully said. The importance of teaching our kids how to eat healthy and to support their bodies, their minds. I mean, food supports not just our physical being, right? It supports our mental health, our emotional health, our spiritual health, our community health. So it's so important to teach our kids at an early age. Well, we've been talking with Jacinda Shapiro, a registered nurse and diabetes coach. And we're going to be right back with more on the IQ podcast. So stay tuned. Well, we are back with the IQ podcast. I'm speaking with Jacinda Shapiro. And Jacinda, I wanted to ask you now, you mentioned earlier about the importance of instituting a plant-based diet or plant predominant diet in the management of chronic health conditions. Can you explain a little bit more about what you're referring to when you say plant-based diet?
Yes. So a plant-based diet does not necessarily mean a vegan diet. So a vegan diet tells us what someone doesn't eat, but it doesn't tell us what they eat. And what you eat by far is much more important than what you're not eating. When you eat enough of the right food, you will just naturally displace the food that you shouldn't be eating. But it is, for the most part, a unprocessed whole plant food diet, which includes fruit. Yes, all fruit. There is no limitation on fruit, including bananas, which so many people believe give them diabetes, vegetables, intact grains. And intact grains as a matter of fact, the lack of intake is actually a risk factor for developing type 2 diabetes. And legumes, there's no food on the planet that extends healthy years lived than beans and lentils and peas. So my approach is making sure that people keep their dietary fat down, and I'll discuss why in a moment, and their dietary fiber up. It's always my recommendation that we need to figure out where you are tracking and begin to increase your dietary fiber. You don't want to do this overnight. If you're someone who's only consuming 15 grams of fiber and then all overnight you start consuming 50 grams or more, you're really not going to feel well. So think about it like going to the gym. You wouldn't begin doing bench presses, never lifting weights with a 45-pound bar and 45-pound weights on each side. You would go get 2 5-pound weights and lay on a bench and gradually work up. You want to do the same thing with fiber. Dietary fat is the driver of insulin resistance. So most people think it's sugar that causes insulin resistance. Sugar is only the symptom. Most of our diets are very high in fat, including vegan diets, especially with all the packaged or alternative meats that are out on the market. But dietary fat is a driver of insulin resistance, and we know this due to MRI. When we infuse healthy subjects, even with dietary fat, within about 150, 160 minutes, we induce insulin resistance. Mm-hmm. So insulin resistance first begins in the liver. This is where the fat begins to store in tissue, and then it stores in muscle, and then it stores in the pancreas. And all of these tissues are not designed to store a lot of fat. Our adipose tissue is, and we have an unlimited amount of storage for fat as well. Mm-hmm. Mm-hmm. Usually takes years, if not decades, for some people to develop. So I try to keep dietary fat under 15%, especially when we're doing disease reversal, especially for those living with type 1 or LADA who are trying to match how much insulin they take to someone who is living healthy with a normal functioning pancreas, and to prevent postprandial highs. But I also want people to think of it this way. So especially for healthcare providers who may be listening, if a patient is admitted to a hospital, let's say for a lung infection, and they present with a fever, and the doctor admits the patient, but only writes for Tylenol. Mm-hmm. So the nurse gives more and more Tylenol, and for a moment that patient looks better. But that patient never gets better because there were never any antibiotics written to treat the lung infection. This is how we treat diabetes in the United States. Every drug on the market treats the symptom. And as we have more and more drugs on the market and we are using more in combination, we are not doing very well. I believe the average A1C, even with all the medications people are on, is 8.5. Less than 50% of the population, their time in range between 70 and 180 is 50% or less. Within 10 years after someone is diagnosed with type 2 diabetes, 50% of them will go on insulin. So, and the reason is we don't get to the root cause. The root cause is dietary fat. And our recommendations for low carbohydrate diets, and by default, if you're not eating carbohydrates, you are eating fat. And fat is the driver of heart disease. It is the driver of cancer. It is a driver of dementia. And it is the driver of type 2 diabetes. And when we don't eat enough complex carbohydrates, we spoke a little bit earlier about the gut microbiome. Our healthy invisible allies that live inside of our gut are fiber-loving microbes. Their only food source comes from fiber. And when they are fed properly, and that's not at 15 grams a day, really at 15 grams or more a day, when they're fed properly, they do amazing things. They modulate expression, they regulate blood pressure, they regulate blood sugars by 4 different pathways. And when we were talking about mental health, the gut-brain connection is a real thing. They make almost all of our neurotransmitters, including serotonin. They make 95% of serotonin. So it is very clear why anxiety and depression continues to increase, because our consumption of the food that feeds these life promoting microbes, they're being starved to death.
Yeah.
So the second we heal the gut, we heal the body. And we can prevent diabetic complications by doing this. People don't die from diabetes, even though it's ranked as one of our biggest top killers. We die from complications. We die
Hmm.
from heart disease and liver failure and kidney failure. But we don't actually die from diabetes. We die from the
Hmm.
complications of it.
Yeah. You brought up so many important points there. I don't know if I'll be able to get to all of them, but one thing I wanted to ask you, you mentioned about dietary fat intake. Now, could you clarify that? Because, I've always been taught in my training that there are healthy fats and there are unhealthy fats. And so it is good to have healthy fats in the diet. For example, omega-3s that come from various different foods, including nuts and seeds. So is it still okay to have enough of that type of fat in one's diet? Or should one, if you're diabetic or pre-diabetic, should you strive to really reduce down to like that 15% that you said or less?
So this is a great question. I'm actually glad you brought this up, because even many plant-based doctors still may have their patients eating too much dietary fat, including healthy fats. So first, let's talk about the unhealthy fats. Unhealthy fats are saturated fats, trans fats, cholesterol in our diet, and these are predominantly in animal products. So whether it's chicken, pork, fish, beef, all of these are high in saturated fat, and they're the only food that contains cholesterol. Plants do not contain cholesterol, but healthy fats eaten in excess can and do create problems for people, whether it drives autoimmune disease or heart disease or diabetes. I see it all the time, especially for those who are living with type 1. We see what even healthy fats eaten in excess does to insulin needs, and it becomes a factor if someone is trying to reverse, and yes, reverse type 2 diabetes. Excess fat is not good. Fat is in everything. And when we look at the omega 3s, a food that you and I agree on that people should consume every day is leafy greens. Leafy greens are a great source of our omegas. They have ALA, and it goes through all 6 conversions, promoting health. I think most of the time we are overthinking health and overthinking what we should be eating. People in blue zones who living people who predominantly eat plant-based are not really overthinking about what they're eating. They're just
Mhm.
eating mostly plants. So I think it's important that we stay focused on just adding more, plants to our diet.
Hmm. Absolutely. I second that. And, I think you also brought up a good point here, which is that the traditional fats, you don't have to get your fats only from those types of foods. There are other foods that also may provide you fats in addition to many other nutrients. So really think about that when you're trying to build your diet in a way that will support your overall health, your eyes, your brain, your heart, your skin, and your immune system as well.
Yeah, all food has fat. And so most of us are not missing out in fat.
Mhm.
And I know people will continue to add it into their diet, but it does elevate blood sugars if we consume too much of it. But this is dependent on person to person. This is where genes do come into play. Some
Mhm.
people can excrete fat a little bit better than others, but during disease reversal, it is really important to keep it low. And then someone can always test it. I have patients who, if they consume more than 3 servings of nuts a week, their LDL is up, their blood sugars are up. And then I have patients who can consume 2 servings of nuts a day.
Mhm.
and still keep it really low when they're healthy. So this is where we need to individualize care as well.
Absolutely. Well, Jacinda, I have learned so much from you just in this short time, and I'm sure our listeners have as well. I wish we had another half an hour to chat, but I know you have patients who are going to be waiting soon. So I really appreciate the time you spent with us today on the IQ podcast. Do you have any last comments or thoughts that you'd like to leave the audience with about diet and plant-based nutrition and diabetes?
So I think the final piece of advice is just to remember that healthy lifestyle practices, especially those rooted in plant-based nutrition, we didn't have time to talk about exercise, but exercise is really important. Movement is meant for life, can have profound effects on our overall health. Um, Especially when we are eating a diet that is abundant in fruits and vegetables. And in fact, lifestyle trumps any medical intervention known to man. And I think some of the listeners may be thinking that this sounds a little too simplistic, but the research does tell us that
Mm-hmm.
lifestyle is our best way to stay healthy and get healthy. I think the bigger thing is implementing healthy habits because they can be challenging. For healthcare providers who are listening, I think it's important to understand that we need to model it. Um, the habits need to begin with us first. So start implementing healthy habits into your lifestyle, and then you're going to be able to support and guide your patients to do the same. For everybody else listening, it is important to keep it simple. Remember two
Mm-hmm.
things: fiber up and fat down, and stay consistent with your habits. It is really important to be kind to yourself. This is not about perfection. I don't know anyone who's perfect. This is just about progress. And the
Mm-hmm.
things we say to ourselves matters. So about mental health, I want you to think about how you speak to yourself. And I want you to speak to yourself the same way you would speak to a child learning how to walk. You would not tell a baby what a horrible job they were doing and that they should stop walking because
Mm-hmm.
they can't get up and start running the first time. And I want you to be kind to yourself that way. And any movement in the direction of eating more plants is positive movement. And we should celebrate that. And we should always be kind to ourselves and keep it simple. Try not to complicate it.
Yeah, again, so eloquently said. You talked about the importance of movement, the importance of increasing fiber, decreasing fats, and also being kind to yourself about this. It's not easy to make these changes, but for example, in your family, there was a definitive reason for wanting to do this. For others, it may not be such a definitive reason. It may just be like, oh, they want to get their sugars under better control, or they want to have better cholesterol levels. If that's your goal, then make some slow changes and work towards that, because every little step counts.
Mhm.
Well, thank you so much again, Jacinda, for sharing all this amazing information with us. If anyone wanted to reach out to you, perhaps become a patient, or and learn more from you, how can they reach you?
So, first, thank you again for having me. It was great to meet you at the conference. Hopefully, I will meet you again at another future conference. So, for me, most of my work does come by referral or through the Plantrition directory, but people can reach out to me direct at Jacinda Shapiro RN at gmail.com. You can call me at 727-758-3800. We can always set up time to determine if this approach is right for you as well.
Well, thank you for that. And we'll include all of your links and your website in the show notes as well, so people can reach out. Well, again, thank you so much for sharing with us. And I will see the rest of you for the next episode of the IQ podcast. Take care.